Primum non nocere, first do no harm. Biomedical ethics is an introduction to some of the primary ethical issues in modern medical practice. My name is Piers Hale. I'm Presidential Professor in the Department of the History of Science, Technology and Medicine here at the University of Oklahoma. And over the coming weeks, we'll consider concepts that have become fundamental to modern medical ethical practice. Over the last 80 years, informed consent and confidentiality have become central to thinking about the physician's obligations to their patients at the center of the patient-doctor relationship. We'll look at what these concepts mean, how they might be applied to achieve their intended aims, but also we'll look at the history of how they have come to be so central to modern medicine and how physicians in the West have come to frame their obligations to their patients in these terms. We'll also see that there remains some doubt and question as to the applicability of these terms, about their usefulness and about the limitations that they might have in achieving their intended aims. We'll read the work of physicians, past and present, as well as philosophers and historians to help us get a grip on these topics and to give us a better insight into the ethics of modern medicine. We'll look at the history of experimental medicine from the 1860s to the present, the moral arguments for the use of animals as experimental models, as well as the dark history and the inherent moral dilemmas that haunt the question of whether it is ever morally permissible to subject one person to the risk of harm for the benefit of another. In modern America, we can't consider the ethics of medicine without taking seriously and thinking seriously about the moral status of embryos, both in terms of research, but also in terms of women's reproductive health and the ethics of abortion. We shall also ask questions and read the debates about when, if ever, it is morally permissible for a physician to participate in bringing about the death of their patient. To consider medicine today, we'll also have to address questions about access to healthcare, and to think seriously again about the origin and effect of social and racial health disparities, about alarming maternal mortality rates and the fact that African Americans and people of colour suffer maternal mortality at much higher rates than white women do. We'll also talk about access to healthcare in the context not only of limited resources like organs for transplant, but also limited resources in terms of respirators for COVID patients. By what criteria are we to choose who gets treatment? We'll read a lot in this class and we'll think a lot too, and I'm looking forward to hearing what you have to say about some of these controversial issues, but fundamentally important issues that are central to modern medicine in America.